For many of us, doing simple everyday activities can create a nagging, painful feeling in the back of the leg. Even something as simple as walking can feel like the area above your heel is burning or stiff. What do all these symptoms have in common? Well, let me tell you. When we have Achilles tendon pain, there are three important pieces of information that we need to understand. The first is how well is the ankle moving. The second is how much adhesion has been built up around the Achilles. And the third is how much adhesion is present in the other calf tissues. As I said, the first thing we need to do is understand how well the ankle is moving. When we have limited ankle dorsiflexion, that can lead to an overloading of the Achilles tendon, which eventually leads to your symptoms. So to do this, we're going to perform the knee to wall test. What we're going to do is I'm going to take this measuring block and put it up against the wall. To perform the knee to wall test, I'm going to take this measuring block and put it up against the wall. I'm going to have our patient put their toes up against the front of the block, and I'm going to have them see if they can move their knee to the wall. The goal here is for the knee to be able to touch the wall as so without the heel coming up, which is not. So this is good. From here, what we're going to do is see how far back we can go before she is able to either not get her knee to the wall or her heel comes up. Then we know what her ankle dorsiflexion range of motion is. Now that we know how well the ankle is moving, we can move on to treating adhesion around the Achilles itself. To do this, we're going to use this metal instrument. And as with the other tissues we use the instrument on, each time we're going to gradually go through and break down the adhesion that's there. To treating the Achilles tendon, there are a few other tissues in the calf that need to be assessed and treated for adhesion. Adhesion in these other tissues is what actually limits ankle mobility. The Achilles is merely a passenger that's along for the ride. Addressing these other structures, which most other providers don't, is essential if you want permanent relief from your pain. These other tissues are flexor hallucis longus, flexor digitorum longus, soleus, tibialis posterior, and the posterior tibio-talar ligament. So to recap, the goal of treatment is to improve ankle range of motion. By doing this, we can take the load off the Achilles, which allows the tendon to heal, which allows for your symptoms to improve.